Hello, good afternoon. My name is Avi. I'm a nurse practitioner student. We'll be doing a head-to-toe assessment today on you. Can you please tell me your name and date of birth?
Date of January 1999.
Okay, thank you so much. I've already washed my hands and closed the door for privacy. We're going to start off with a mental status exam. Can you tell me where you are right now?
Doctor's office.
Alright, can you tell me today's date?
May 1st, 2025.
Okay, I'm going to have you say 3 words. I repeat after me. Dog, table, apple.
Dog table apple.
Okay. Can you subtract 100 minus 7?
93.
What's 93 minus 7?
86.
Okay, I want to say 3 words. What are those 3 words that I said earlier?
Dog table apple.
Patient's alert, oriented, times 4. Speech is coherent. We're going to start off with the skin. We're going to inspect the skin. Skin looks fine. We're going to palpate the skin. Any tenderness in the skin?
No.
No tenderness reported. We're going to inspect the head. Head looks atraumatic. No tenderness, no masses, no lesions, no scales. Hair distribution is equal. We're going to palpate the skin, the head. Let me know if there's any tenderness as I palpate.
No tenderness.
Okay, no tenderness reported. No lesions or masses were felt upon palpation. Head is symmetrical. We're going to palpate your temporal arteries. Let me know if there's any pain. No tenderness. No tenderness reported. Temporal arteries were 2+, which is good. Okay, we're gonna now move down to the eyes. We're gonna inspect the eyes. Let's start off with the visual acuity test. We're gonna have you do the Rosenbaum test. Have you cover one eye. Read me this line, please.
EBTZ.
Okay, cover the other eye. Do the same line backwards.
ZTP.
Using both eyes, read me the line.
EPTZ.
Vision is 20/20 bilaterally. Cranial nerve 2 is intact. We're going to inspect the eyes. Eyes are symmetrical. Eyebrows are symmetrical. Okay, hair is evenly distributed in the eyebrows. We're going to inspect the eyelids. Eyelids look fine. There's no crusting, no discharge in the eyelids, no redness. Can you take off your glasses for me? Okay. Medial and lateral canthus, no crusting. Iris is brown and well defined. Sclera is white. No jaundice in the sclera. Okay, we're gonna look at your conjunctiva. I'm gonna have you, I'm gonna pull down, have you look up. I'm gonna pull up, have you look down. Very good. Okay. Pupils are 3 millimeters in size. Again, no discharge, no redness in the pupils. Eyelashes are symmetrical. Okay. We're gonna perform the pen light. We're gonna test your pupillary constriction. Okay. So pupillary constriction. We're gonna shine the pen light in your eyes. Just wanted to mention the cornea. Inspecting the cornea looks normal. No crusting, no lesions. Have you look at me. I'm gonna shine the light in your eyes. Okay, pupils constrict 2 millimeters, which is good. I'm gonna test for consensual constriction. Very good. Pupils constrict consensually. Test for accommodation. Look at that wall. Fix your eyes on that wall. Now look at my pen light. Very good. I'm gonna test your peripheral vision. Can you cover one eye? Okay. Let me know when you see my fingers wiggle, okay?
See.
Thank you. Cover the other eye. Tell me when you see my fingers wiggle.
See.
Okay. We're gonna test for extraocular movements. Look directly at my finger. I'll go up, hold, 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 hold. Very good. Cranial nerve 3, 4, and 6 are intact. No nystagmus noted. Okay, we're gonna do the fundoscopic exam. I'm gonna turn off the lights. I'm gonna inspect your right eye with my right eye. Look at me. Okay, I can see your retinal red eye reflex. Retinal vessels are present. no opacities are present. Okay, margin disc ratio 0 to 3. Macula is visualized. Okay, now we'll do the same to the opposite eye. We'll turn the lights back on. Okay, we're gonna palpate your lacrimal sac. Let me know if there's any tenderness.
No. No.
Okay, no tenderness, lacrimal sac. We're gonna move down to nose. We're gonna inspect your nose. Nose looks fine, symmetrical. We're gonna test your smell. Cover one nostril for me. Close your eyes. What do you smell?
Cinnamon.
Cover the other eye, nostril. Tell me what you smell.
Coffee.
Coffee. Okay. Cranial nerve 1 is intact. Great. Okay, we're gonna go ahead and palpate the nose. Any tenderness upon palpation of the nose? No tenderness reported. Okay. We're gonna go ahead and take a look inside your nose using a speculum. We're gonna first palpate your frontal and maxillary sinuses. Any pain?
No.
Okay, we're gonna look inside the nose. Have you tilt your head for me? Okay, look inside the nose. Nasal mucosa is pink. No nasal polyps. No septal deviation. Okay, very good. We'll do the same to the opposite nostril as well. Okay, no nasal discharge was present. Okay, so that is for the nose. No bleeds as well. Going down to the mouth. We're gonna inspect the mouth. We're gonna start with the lips. Lips look pink and moist. No bleeding, no redness, no rashes, no lesions on the lips as well. I'm gonna have you smile for me. Show me your teeth. Open your mouth. I wanna see you. Oh, go inside. Okay, buccal mucosa is pink. Very good. Tonsils are present, 2+. Soft and hard palate. Pink and moist. Can you open your mouth? Bring your tongue up, down, left, right. Very good. Not a problem. Patient's able to do it easily. Cranial nerve 12 is intact. Like we said, let me open your mouth one more time. Okay, all teeth are present, tonsils are present, and 2+. Very good. Okay. I'm gonna have you close your eyes. Tell me when you feel my cotton tip. Okay, very good. Can you please open your eyes, puff your cheeks, clench your teeth, smile, raise your eyebrows. Very good. Okay, cranial nerve 7 is intact. Okay, proceeding well. I'm gonna go to the ear. We're gonna first inspect the ear. Ears, auricle are symmetrical bilaterally. Nothing on the ears. No rashes. No lesions on the ears. No nodules present on bilaterally. Okay, we're gonna perform the whisper test. Okay, I'm gonna stand behind, cover that ear. I'm gonna say 3 words. Tell me what you hear.
1, 2, 3.
Thank you. Cover the other ear. I'm gonna say 3 words. Tell me what you hear.
ABC.
Great. Cranial nerve 8 is intact. Perform the Weber test. Tell me if you hear the sound on both ears or just one ear.
Oh.
Both. No sensor under hearing loss. We perform the Rhine test. Tell me when you stop hearing the sound.
Stop. Stop.
Great. Air conduction is greater than bone conduction. Okay. Very good. We're gonna insert the spit. We're gonna palpate your tragus. Any pain? Say palpate. Mastoid. Any pain? I'm gonna insert the speculum. Look inside your ear, pulling the pin up and back. Okay, moderate amount of cerumen, cone of light is present. Tympanic membrane, no bulging, no perforations. Cone of light is at 4 p.m. Okay, no discharge was present. I'll do the other ear as well. Okay, tympanic membrane is pearly gray. Cone of light is 7 p.m. Okay. Alright, very good. Going down to the neck, I'm going to inspect the neck. Okay, no lesions, no masses, no redness on the neck. I'm going to palpate your thyroid using one finger. Okay, no deviation. I'm going to have you take a sip of water. Palpate your trachea, sorry. That was your trachea. I'm going to palpate your thyroid. Take a sip. Okay, I can feel the lobes are present. Very good. Cranial nerve 10 is intact. Okay, I'm gonna palpate your lymph nodes. Alright. Preauricular, postauricular, occipital, submandibular, submental, supraclavicular, deep cervical chain, posterior cervical chain, tonsillary, and supraclavicular. Any tenderness as I palpate it? No tenderness reported. Okay. Okay, very good. Okay, moving down to the chest. We're going to inspect the chest. No bulging, no retractions. Patient is breathing fine. Okay, AP to lateral is 1 to 2, which is normal. Chest and rises without any issues. We're going to percuss. Okay. We're going to now palpate your chest. Let me know if there's any tenderness as I palpate it. Okay, no tenderness. I'm going to also take your breath sounds anteriorly. Breathe in. Take deep breaths in, out, in, out, in, out, in, out, in, out, in, out. Okay. Want to assess your chest posteriorly. Okay, we're assessing, there's no redness on the chest. We're inspecting the posterior chest, no redness. Want to check for chest expansion under the 10th rib. Can you breathe in for me? Out. Okay, chest expansion. The chest expansion is normal. We're going to percuss all the fields. Okay, very good. I'm going to auscultate the posterior chest. Breathe in for me. Out, in, out, in, out, in, out, in, out, in, out. Okay? We're going to test for diaphragmatic exertion. Breathe in for me and hold. Okay, we're going to mark the area of dullness over here. Okay? Exhale fully. Fully exhale and hold. We'll mark the area of dullness. It's about 0.4 centimeters, which is normal. We're going to test for tactile fremitus. When you feel my hand, say E. Okay, very good. We're going to test for egophony test. When you feel my stethoscopes, we're going to test tactile fremitus. When you feel my hand, say 99. Okay, when you hear my stethoscope, say E. Okay, E was heard or ah. We're gonna say to do the whispered petroculi test. When you feel my stethoscope, say 1, 2, 3.
1, 2, 3. 1, 2, 3. 1, 2, 3.
Okay, 1, 2, 3 was muffled. We're gonna palpate any tenderness. No tenderness upon palpation. Good. Okay. Everything was normal. Okay. check your blood pressure, go on to cardiac. Pressure is 120 over 75. Pulse was 75 as well. I'm gonna check the radial pulse. 15 seconds. Okay, pulse is confirmed to be 75. We're gonna identify the landmarks of the heart. Second intercostal space, the right sternocleidomastoid is aortic. Second intercostal space, pulmonic. Fourth intercostal space, tricuspid. Fifth intercostal space, clavicular is mitral. I'm gonna auscultate your heart sounds using the first diaphragm. Okay, S1, S2 were heard. We're gonna use the bell. Okay, S1, S2 were heard. Very good. We're gonna have you lean forward. We're gonna auscultate your heart's the same landmarks while you lean forward for me. Okay, using the bell as well. Okay, we're gonna palpate your apical pulse for PMI. Okay, everything is normal, no deficit. Okay, we're gonna have you put the head to 30 degrees. We're gonna have you look at your jugular veins, left, right, no distension. We're gonna palpate your carotids. Okay, carotids are 2 closed. We're gonna palpate for any heaves. Okay, for the landmarks for any heaves. Okay, we're gonna palpate again the apical pulse, fifth intercostal space clavicularly. Like we said, PMI is barely palpable, so that's good. Okay, we're gonna auscultate with at the head of the bed at 30 degrees. Okay, I'm gonna use the bell. Aortic, it's aortic, pulmonic, tricuspid, and mitral. Okay, very good. Moving on to, we're gonna inspect for any cyanosis, the vascular system, no cyanosis, no clubbing noted. We're gonna palpate the pulses, put the pulses, brachial, radial, femoral, posterior tibial. Okay. Palpate the pulses. Okay, we're gonna auscultate for any bruits. The abdominal, femoral, abdominal renal arteries, femoral. Okay, no bruits were auscultated using the pelvic stethoscope and renal nodes. We're going to inspect the abdomen. Abdomen is symmetric. There's no bulging of the abdomen. I'm going to auscultate each quadrant of the abdomen. The pelvic stethoscope. We'll auscultate each quadrant of the abdomen. Right upper quadrant, right lower quadrant, left lower quadrant, left upper quadrant. Okay, normal bowel sounds. We're going to percuss lightly the abdomen. Any pain? We're going to palpate, sorry. First we're going to percuss. Timpani was heard. Now we're going to lightly palpate. Any pain? Now we're going to do deep palpation. Any pain? Okay, we're going to percuss the spleen. Spleen is about 6 centimeters, which is normal. We're gonna percuss the liver. Sorry, that was a liver. because the liver, which is 6 centimeters, we're gonna go on to the other side, do the spleen. Any tenderness?
No.
No tenderness noted. Okay, now we're gonna do percussion of the spleen. We're gonna percuss the spleen. Let me know if there's any tenderness.
No.
Also take a deep breath in for me and hold. Palpate the liver. No any tenderness. I said palpated the liver. No tenderness. We're gonna palpate the spleen to see if it's palpable. Breathe normally. Okay. Spleen was not palpable upon percussion, which is normal. Palpation, sorry. Okay. Now I'm going to palpate the inguinal nodes. Okay, no masses were felt. Can you sit up for me? Okay, I'm gonna check for the costrovertebral using the costrovertebral angle using the punch test. Okay, let me know if there's any pain, alright?
Mm-hmm.
Any pain? No pain reported, very good. Okay, moving on to the musculoskeletal portion of the exam. I have you stand up. Walk back and forth for me, please. Okay, gait is normal. Okay, patient doesn't have any wobbly gait. We're gonna inspect the back, the spine. Okay, spine looks normal. Okay, no curvature, no scoliosis, no kyphosis. We're gonna palpate the spine. Any tenderness? No tenderness reported. We're gonna test your range of motion of the spine. Can you bend down for me and try to touch your knee to your toes? Very good. Try to go back for me, please. Okay, side to side. Okay, full range of motion in the spine. Very good. You can have a seat. Okay. So now we're gonna assess your TMJ. Okay. Any pain? Any tenderness? Okay, no masses. No crepitus were noted. Can you look at me, move your jaw side to side. Okay, patient didn't have any issues with that. I'm gonna palpate your shoulders. Let me know if there's any tenderness.
No.
Any tenderness? No tenderness, no crepitus, no masses. Can you raise your arms above your head like this? Swing them backwards. Very good. That's good. Full range of motion. Take each arm. Try to touch the scapula of the opposite side. Okay. Very good. So full range of motion over there. Okay. So that's that. Okay. Can you shrug your shoulders to me? Okay. So now do without resistance, shrug your shoulders. Very good. Cranial nerve 11 is intact. Okay. Alright, now we are going to palpate your elbows. Pick up your arms. Palpate your elbows. Any tenderness?
No.
No tenderness, no masses or crepitus felt. Your wrists. I'm going to palpate your wrists. Okay, make a fist. Down to the floor. Up towards the ceiling. Very good. Fingers. And palpate the fingers. Any tenderness? I palpate the fingers. No tenderness. Same thing with the fingers. Up towards the ceiling. Down towards the ground. Take your thumb. touch each finger with your thumb. Okay, very good. No masses, no crepitus in the fingers, okay? Moving down to the legs. I'm gonna go down to the knees. Okay, I'm gonna palpate your knees. Any tenderness that palpated? Okay. Can you good flex, extend? Okay, other leg. Okay, can you bring your knee towards your chest? Okay, stand up for me. Bring your leg towards your glutes. Very good. Okay, now lay down. Bring your knee towards your chest. This one. Okay, towards your chest. Okay, other knee. Bring your knee close to your chest as much as you can. Very good. Full range of motion over there. Okay. Okay, while you're laying down, we're gonna do your hips. We're gonna do abduction, adduction. Okay. Internal rotation and external rotation. Very good. Do the other leg. We're gonna abduction, abduction, internal rotation, and external rotation. Okay, very good. So you have full range of motion. We're gonna go down to the ankles. I'm gonna palpate the ankles. Any pain, any tenderness? Okay. Can you move your ankles in a circular motion? Very good. Full range of motion in the ankles as well. Okay, I'm gonna palpate your foot. Any tenderness? No tenderness, no crepitus noted in the foot. Bend your foot down. Point your feet down. Point your feet up. Awesome. Full range of motion in the feet. Very good. Okay. So we tested. Okay, tested that. Alright. Okay, now let's test your muscles. Okay. I'm gonna clench your mouth. I'm gonna try to resist me opening your mouth. We're gonna test your TMJ. Very good. Strength is 5 out of 5. Okay. I'm gonna put resistance against your shoulders. Okay. Try to shrug your shoulders as I put my hands. Okay, very good. 5 out of 5 strength. Okay. Alright. We're moving down to the wrist. Okay. Want to test the strength of your wrist. Again, try to move down. Move your wrist down. Good. Up. Awesome. Strength 5 out of 5. Other arm. Up. Very good. We're going to test your elbow strength. Put your hands above your head with your palms out like this. Try to push against resistance. Good. Elbow strength 5 out of 5. Awesome. Okay. So we tested the elbows. The shoulders, the elbows. The wrist we tested. Moving on to the leg. Okay. We're going to test the hip. Okay. Palpate the hip. Already palpated the hip. That's good. We're going to test the range of motion. Can you, against resistance, can you, okay, down, okay. Same thing with this leg. I'm going to resist, good, push down, awesome. 5 out of 5 strength of the hips. So, we'll do the hips first. No. Resist, pull down, go up, Go up, go down, and do the same thing for the legs like we just did. The hips, the legs, now going down to the feet. Okay. Put pressure, good. Down, good. Same thing here. Up, good. Down, good. Okay. I'll have you stand up. We're gonna test for upper extremity drift. Okay, I'm gonna have you close your eyes, extend your hands. Good. And hold like that. Good. Have a seat. Moving, no upper extremity drift. We're gonna move on to the sensory exam. I'm gonna have you close your eyes. Close your eyes. Tell me what you feel.
Pinch.
Pain?
Okay.
Okay.
Smooth.
Light touch. Tell me what you feel.
Oh.
Okay. Close your eyes. Tell me what you feel. Vibration, good. I'm gonna put something in your hand while your eyes are closed. Open your hand for me. Tell me what you think it is. Okay, pen light, very good. I'm gonna have you stand up. I'm gonna have you walk from heel to toe, there and back. Okay, now walk on your heels. Very good. We're gonna test the Romberg test. I'm gonna have you close your eyes. Okay, patient is not swaying, very good. I'm gonna do finger to nose test. Touch my finger, touch your nose as fast as you can. Very good, okay. Okay, you can have a seat. Okay, there was no swing, it was normal. Now we'll do the heel to shin test. Bring your heel to your shin, good. Heel to your shin, very good. Okay, now we'll do the deep tendon reflexes. Okay, good. Tricep, good. Patellar, good. Achilles, okay. All tendons are present. 2+, reflexes are 2+. We're gonna go down to the Babinski test. I'll take off your shoe. I'm gonna draw a J. Fingers curl. Fingers curl. Good. That'll be the end of the exam. Thank you for your time and you have a good day.
Pinch.